Welcome to my educative channel. Today I'm going to talk about upper eyelid blepharoplasty. This conventional technique was developed many years ago, and this technique consists in resection of the upper eyelid skin and also orbicularis muscle and the removal of the upper eyelid fat pads. Today, around the world, every plastic surgeon are perform this kind of procedure. Nothing changed with the time. Something changed in many congress, in many meetings, and also internet. Someone said that they perform laser blepharoplasty, but the question is they cut with the laser instead of cutting with the scalpel. Nothing changed, and this is taken from internet. You have a protection of the eye, a shield that protects the eyes, and this is the resection. The surgeon cut with the laser and make all these stitches. All this, nothing has changed. And you have young patients with all these long scars. But this technique, conventional technique, not only remove upper eyelid skin, the skin that most remove is the eyebrow skin. This is upper eyelid skin and this is eyebrow skin. This is the hair of the eyebrow, but all the skin belongs to the eyebrow. Here, not eyebrow was left skin, and if you can see here, this little bit is upper eyelid skin. You can see thinner, and this skin is thicker, different texture. And the important thing of this is not that the blepharoplasty is wrong call, because blepharoplasty comes from the Greek blepharon, and plasty is the treatment of the blepharon. The important thing is this technique remove the eyebrow skin and pull down the eyebrow hair. You can see here almost no skin, the eyebrow was left. Mayo Clinic this year. And if this technique remove the eyebrow skin, is going to pull down the tail of the eyebrow, the body and the tail. And if we pull down the tail of the eyebrow with the resection of the eyebrow skin, we produce eyebrow dropping or ptosis. This accelerates the normal aging process and make the patient look sadder, tired, and older. You can look some friend or some parents, and you see to the eyes that was operated. You can recognize they have no folder for the resection of the skin, but they look a little tired, a little different, badly different. I'm going to explain you. When we age, we can call this the head, the body, and the tail of the eyebrow. When we get elder, the tail and the body is going down more than the eyebrow. And for this reason, like the ptosis or the dropping of the eyebrow in the aging process is more important than the flaccidity of the upper eyelid skin. Then, if this going down and you remove this, you are going to pull more down. Then you accelerate the aging process. Maybe you have not this folder here. Let me explain in this way. All this in the aging process acquire an old, sad and tired expression. If we make a draw, it's just this. And this expression is because we have a ptosis of the eyebrow. And this ptosis is more important in the tail than in the head, like this. And this is the patient was operated in the upper eyelid and lower eyelid. You can see almost no skin of the upper eyelid and the eyebrow was left. Look very different, very old, very tired. And this is many patients come to see me from 1994 to the present with this kind of expression. And this is the technique, the upper blepharoplasty technique. And you can see no upper eyelid skin was left. And this scar belongs to this conventional blepharoplasty. And in this poor young patient, the tail is here, must to be here. This resection pulled down. And this patient is with the lack of thalamus and big scar. No skin of the eyebrow was left. And this is the upper eyelid skin. Almost no upper eyelid skin was resected. Most of the eyebrow skin was resected. You can see here. 24 years old. This is the upper eyelid and all this is the eyebrow skin. Another cases, tired look, 24 years old. Tired, sad. This patient came to me and said, "Doctor, I performed conventional blepharoplasty 1 year ago and look my face. I look completely different. I have no folder skin here, but my expression is sad. I saw your videos and asked you to perform a forehead lift to reposition again the eyebrow in a higher position. No eyebrow skin and the pulling of the eyebrow, and many patients that come to the office and said, "Doctor, I want to perform an blepharoplasty, but they pull down the tail. What really they need is a forehead lift." And as you can see here is the conventional blepharoplasty with a skin upper eyelid resection and eyebrow resection, and all this picture that was taken from internet with big scar, long scar that prolonged to the canthal sternum. And what I proposed since 1994, and my first publication was in 1998, was a stab incision in the upper eyelid to remove the upper eyelid fat pads, like you see here, and rejuvenation of the old periorbital area with carbon dioxide laser. What I perform is rejuvenation of the skin instead of resection the skin. This changed completely different the idea of conventional blepharoplasty for a less invasive procedure. In the future, the conventional resective blepharoplasty will be abandoned completely. This new idea changed the future of the blepharoplasty. It's not called laser blepharoplasty because today many plastic surgeons resect the skin with the laser, but what I propose is the rejuvenation of the skin with carbon dioxide laser instead of resection of the skin. Here we can see the upper eyelid fat pad was removed and the tightening of the skin with laser. And this is the pre and post operative. 7 days after the procedure. You can see an improvement of the skin and you can see no scar at all. You can see how the laser improved the quality of the skin 7 days after the procedure, and you can see no scar at all. This small stab incision do not need sutures, do not leave scar. This is the comparison between conventional and my personal technique. It is a fact. This is what I'm doing. I treat thousands and thousands of patients. I have international recognition. I have nearly 1,200 educative videos about this subject. I have published a lot of publications. What need the surgeon in the future to perform this kind of technique are two things. One, the ability of remove the fat pads without removing the skin. And the most important is to use the laser in a way that can be tightening the skin instead of rejuvenation. Tighten and rejuvenation the skin instead of resection the skin. You can see here again the comparison between the technique that are using all around the world. You can see many patients from France, for United States, ask for this technique in their countries with the best plastic surgeon of their countries, and nobody performed this technique until now. But I call this technique a no invasive technique, a laser technique, and this will be the technique of 22 centuries, because in the 22nd century nobody in the world is going to do this conventional resective and damage technique. They are going to use this one, and many medical doctors around the world come to my clinic to understand this procedure, to learn this procedure, and I think little by little in the whole world are going to perform this technique that I have many years of experience, 1994 to the present. July 2022, thousands of patients was treated. It is impossible resecting skin. You can improve the skin of all this area. This patient need my personal technique of blepharoplasty without skin resection, with skin rejuvenation, but also this patient need a eyebrow reposition, because this eyebrow is down, here is down, was a ptosis of the eyebrow, and in the near future this patient will come again to perform an endoscopic brow lift. I call invisible endoscopic brow lift. But this presentation is only to compare the conventional blepharoplasty, upper blepharoplasty, with my personal technique. You must go to see another videos about forehead frontal lift without scars, and also you can go to see lower eyelid blepharoplasty without scar. You can see this patient here have no scar and a periorbital rejuvenation. All the skin was rejuvenated. And this is what I performed in this patient, this laser. And here you can see how the laser contract and rejuvenate the skin. You can see this, you can see the tightening here. And this skin will be better when I perform an upper eyebrow technique. You can see here the improvement of the skin, the tightening of the skin. It is impossible with a skin resection here to improve all the skin of this area, and you can see here this is only the upper eyelid skin, and this is the eyebrow skin, and this is the ability of the carbon dioxide laser to tighten and rejuvenate this skin. You can see again, no scar at all, full skin rejuvenation, periorbital rejuvenation, and this is what it is. Okay, you must go to see lower eyelid blepharoplasty and the endoscope brow lift, because also I developed a new techniques without scars to reposition the eyebrow and also to treat the lower eyelid.